Go.
Okay, so Valerie, what made you first start being a part of Timmy then?
Well, I have always enjoyed going to foreign countries, especially third world countries, and volunteering. And Timmy was what I found to be the best source of healthcare volunteering out in third world countries. So that's what immediately got me interested.
Okay, and I know you work as a nurse back in the States, and so being here in Timmy and seeing all these people, what do you think is one of the number one medical cases that affect the people every day?
Yeah, so basic stuff is women's health is a big issue. They do not have very good education on birth control or proper hygiene even, just in general for everyone. You see a lot of people who have urinary tract infections or yeast infections, and also just as I'm doing tests, you can really tell their hands are just absolutely filthy. So I feel as if a lot of the kids here and the adults in general have disparities just because of lack of basic hygiene and lack of education on that hygiene. And same with kids in cavities. They do not necessarily brush their teeth and they get cavities, or they'll get parasites because they do not boil their water.
Yeah.
So just that kind of basic lack of education.
And what have you personally gotten out of being part of Timmy?
I believe it has developed me as a professional, and it really broadens my perspective on the importance of just the basics, and just it really opened my eyes to there are still parts of the world that do not have basic health care that we can easily access in the United States, and it's really shown me that there's a huge need for that and volunteers like us to come and help these people out.
Great, that was good.
Well, the Ministry of Health can't reach every community, so that I think that with these kind of brigades and these kind of things, we can reach them and we can help them, and they need this help. And also medicines. We run out of stuff really quickly, so with this I think we can complement that.
Yeah. Why did you decide to join Timmy then?
Well, I think that well, I think that I feel like I have to help more people.
Yeah.
And in big cities, kind of you help people, but these are the people that are the ones most need. So that's right.
What do you think you've gotten out of being with Timmy then?
I learned a lot what I learned.
Yeah.
So I learned about teamwork. How even if I didn't meet you anytime, now we are really good at teamwork. We have the same objectives, and how we reach to the people and help them. That's really nice, and I feel that there's still hope.
Yeah. So then what do you get out of the mission itself with coming to Ecuador and working with everyone? How has that changed you as a person?
Well, I don't know that it's changed me. I've lived out of the country some, but I find Latin America and Spanish-speaking people to really to be special individuals. To some extent, I don't think that we're that different from them. I think we're really more similar than we're different. And but we have very different opportunities in the U.S. than individuals in Ecuador. And I think it's a good mission for us to be down here and help as we can.
Great.
Well, I've been working in development for 7 years now. I move around to a different country every 1 to 2 years, so this was definitely a great opportunity. I just joined two things that I love, which is education and health. So this is a great opportunity to do that.
And what are some of the bigger problems that you've noticed while working with Timmy in Ecuador?
With the communities in general, or
Yeah.
with the communities, I would say some of the biggest problems is the physical access to healthcare. As we've seen here, there's hills all around. There's little houses here and there, and they have to go down to a river and come back up somewhere. So they have to walk 4 hours to get to a health center, and they have a cane, and they can't do it. Obviously, they won't make it there. So that's definitely one of the biggest ones. Another one is lack of education in general. So a lot of people don't allow themselves to be vaccinated or don't visit the health center because there is no they just don't understand the importance of it and how it could actually impact their lives. So that's definitely another big one. And I would say the third one would be lack of resources. Ministry of Health in general here just it's free healthcare for everyone, but they don't really know how to actually cover all the expenses for that. So we obviously have a lot of issues that there's not medication sometimes, there's no gloves sometimes in the health center. There's like a lot of just lack of resources in general. So that's the other one.
My trip to Guangaje, Ecuador has helped prepare me to become a nurse that will advocate for preventative care. And I think that's one of the biggest things that I can take away is how can I help the world knowing what I do now. So that's what Timmy helped do for me.
There's just so many different health disparities that are common around the world that I didn't even know existed, but at the same time gave me hope that my small contribution was able to make a lifelong change for somebody and that it can be permanent if we continue doing what we're doing.
Coming back from Ecuador, I'm a much more appreciative person. I think I don't take the little things for granted anymore. Having sunscreen, access to ibuprofen, things that the people in Ecuador or Guangaje don't really have. It just really, the whole trip opened my eyes to a different part of the world and made me a much more appreciative person.
Not only to get immersed into a different culture, but just a good opportunity to see like how teamwork can stem not only through different individuals, but globally, really. I thought it was just an experience really that took us out of the academic setting and brought us into real life situations. And for that, I'm always going to be grateful.